Welcome back. If you are pregnant, breastfeeding, or you want to get pregnant, you likely have questions surrounding the safety of the COVID-19 vaccine. WBTV is on your side digging deeper as the World Health Organization says it's not recommending the Moderna and Pfizer vaccines for pregnant women, except if they are at high risk of exposure or have pre-existing conditions. Now, it is similar to guidance from local doctors who say the vaccine should be considered for pregnant women on a case-by-case basis. And since the answer is not so black and white, a Charlotte pharmacist who is on the front lines and pregnant walked us through how she made her decision. Dania Reynolds is a clinical pharmacist in infectious diseases at Atrium Health. Every day she's studying drugs and treatments and working to help people fighting diseases, including COVID-19.
It's a very interesting time to be in my role because there are new drugs coming out all the time with hopeful clinical benefit in patients with COVID.
Dania is also 34 weeks pregnant. So when she first learned several weeks ago a COVID-19 vaccine was on its way, she was anxious to learn more.
Initially, I was very excited that there was going to be a vaccine. And then my next question was, well, how many, because I am a clinical pharmacist in infectious diseases, my first question was how many pregnant patients did they include in the clinical trials?
Dania says when she learned there was no data on pregnant women in clinical trials, she turned to her OB, her physician, and other colleagues. She says her decision came down to risk versus benefits, something Atrium's interim chair of OBGYN, Dr. Nina Connor, says every pregnant woman should discuss with her doctor.
We know that pregnant women are at higher risk for severe COVID disease, although most pregnant women are going to do fine with COVID, but we do have pregnant women who end up in the ICU. And unfortunately, we can't determine who's going to have severe disease and who isn't.
Dr. Connor says right now the American College of Obstetricians and Gynecologists says pregnant women should be able to get the vaccine if they want it. But because of the lack of data, they also haven't gone as far as to recommend it. So Dr. Connor says things you should consider include prevalence of the virus in your area, underlying medical conditions like hypertension or diabetes, and risk of exposure to the virus. That last one was big for Dania, who ultimately got vaccinated.
I was reassured that there were about 20 patients in some of the clinical trials that ended up getting pregnant. And so far, there haven't been any issues compared to the patients who got placebo in that trial.
Dania had no side effects after her first dose, but says she did develop common side effects like chills and muscle aches after her second dose for about 24 hours. Since then, she says she hasn't had any further issues, and she's still on the front lines until baby girl arrives in March.
I'm excited once my baby is old enough to be able to talk to her about this and explain to her just the historical significance of what was going on as she was developing and all the tough decisions that I had to make.
Now, I did ask Dr. Connor specific questions about this being a messenger RNA vaccine versus a live vaccine and the thoughts on possible impacts on mom and baby as a result. We also talked about the vaccine and breastfeeding, as well as if you're trying to plan a family. And I've broken down that full conversation for you right now on WBTVnews.com or the WBTV News app. And in the meantime, if you've got more questions, we have more answers for you and your friends and family. Just head right now to WBTV.com/vaccine.